Carrying out a gender or a reconstructive identity is again the mainstay whenever you are working as a forensic odontologist or a forensic dentist. So it's again the mainstay over here. We've already discussed that it can be just a general identity maintenance. Whenever we are talking about a general identity, it means that you're just excluding the gender of the person, the age of the person, and the race of the person. So this is the mainstay over here. And then we are also considering the reconstructive identity over here. If you have the dental records at your hand, that is the prerequisite required whenever we have the reconstructive identity and we have to perform it and we want to perform it. You should have the dental records of that person. Reconstructive identity can be defined as basically you want to get the complete identity and you completely identify the person through his documentations or the previous dental records. So that will be a complete identification in a true sense. Over here in this section, we are basically focusing upon the fact that we are considering the determination of the gender and the race through the dentition of a person, and then we're also determining the age of the person through the dentition, and then we are basically having the comparative identification from the teeth. Whenever we are talking about the comparative identification, this is basically the reconstructive identification that we were talking about. Reconstructive identification means, in a true sense, you're going to identify the person, including the name, the age, the sex of the person, and you're going to get the complete details of the person along with it. And it is possible only in the cases whenever the dental records, previous dental records are found in a particular case. So the general or the reconstructive identity is again very important. We can have decomposed or skeletalized bodies if we are basically talking about the pre-ancestral remains. The jaws are usually intact and a lot of skeletal remains. And then we can have the dry skeletons. The teeth are usually loosened and they flat out whenever we're talking about the dry skeletons, especially the single-rooted canines and the incisors. Talking about the fragmented bodies and the skeletons, the jaw remains remnants and the teeth are recognizable in this particular case. And the human teeth are distinguishable from the animal teeth. Even the jawline is quite different of the animal teeth. It's usually a more U-shaped jawline when we're talking about the animals in a particular case. So the determination of the gender is very important on the other hand. It can be the gender determination. The teeth are poorly discriminating and they are of little value over here. The most important thing that we can consider is the mandible. So the mandibular protuberance or the mantle protuberance is quite in a quadrilateral shape when we're talking about the males, and it is quite rounded in the females. The male teeth are usually larger. The girl's teeth or the female teeth, they calcify and erupt earlier. The extraction of the pulp tissue from the tooth is again very important, and we can have the determination via the DNA in such a case. While we're talking about the determination of the race and its effects, the mongoloids basically are the shovel-shaped upper central incisors. So whenever we're talking about the mongoloid racism, it's basically the shovel-shaped incisors that are going to be critical whenever we're going to enlist a person that he was from a mongoloid origin or from a mongoloid race. The posterior surface in such a case are usually they have a central depression and the enamels are pearl colored. So this is usually the terminology used for the mongoloids. Then we can have the taurodontism or the two marginal bars. It's again one of the critical criteria that is used to distinguish the mongoloids. Then we can have the Caucasian groups or the Asian people. Usually they have the lateral incisors in the upper jaw. The smaller the incisors in the lower jaw are usually smaller and central. They have long pointed canine roots and the Caribbe's cusps, or there's an extra cusps in the molars. So usually the molars have 4 cusps, and if we have an extra cusp, that is known as the Caribbean cusp, and that is usually found in the Caucasian group. The Negroid races usually have the larger teeth and they have more cusps on the molar. Even they can have up to 8 cusps because they have the larger teeth. 2 lingual cusps on the mandibular, and then we can have on the first premolars. So you can basically distinguish these different racial phenomena over here. We can have Mongoloids, Caucasian groups, and Negroid races, depending upon the characteristics of the teeth. Features of the Mongols are also found in the Chinese, Eskimos, and Japanese, and we have to keep these regions in mind as well. So the sequence of the deciduous teeth has to be kept in mind. We can have the appearance of the permanent dentition at this level, and an average timetable is usually given in this sense. If we have the baby teeth and we've already identified that it's an infant or it's a toddler, we can basically identify that the central incisors that usually come up at the age of 9 months, and then we have the lateral incisors at the age of 12 months, we have the canines at the age of 18 months, and we have the first molars at the age of 15 months, and then we have the second molars at the age of almost 26 months, and we have also a charting done for the age on which these teeth are lost. So we have 7 years for central incisors, 8 years for lateral incisors, 11 for canine, and 10 for first molar, and for second molar we have 10. So even there is a difference between the eruption and the losing time of the lower teeth. So all of this knowledge is very critical at this stage for this comparison phenomena. The age determination from the fetal health is again very important. It is basically a matter of embryologists, and the use of the Lemendin's method and the method evaluating the reduction of the pulp chamber through the x-rays and the radiographs is done to determine the age of the individual in a particular case. The state of teeth in respect of wear, hygiene, and color, it's again very important. It basically increasing age is shown by the marked occlusal adhesions. Sometimes they go down to the gum level, and the edentulous jaws are found in the advancing age or in the old age. The general atrophy of the alveolar margins is also looked upon. We can have a poor criteria of the age variability in time when the teeth is lost. The new techniques, they include the variation of the racemization of amino acids, or it can be the aspartic acid phenomena. We can have comparative identification from the teeth as well. It is very important to establish the personal identity of the person over here. The previous diagnostic and therapeutic surveillances that were used were of critical value over here. The collateral evidence indicating who the unknown body belongs to, it is the mainstay over here. Circumscribed population search records are again very important. We can have the completeness and the quality of data, which is impracticable. And the records must be traceable as well. The records of the recovery of the dental radiographs are also taken into account for the comparative studies. The dental records provide a description of the dentition and the jaws, and there can be a lot of discrepancies to these records. The first discrepancy is usually the records indicate the irreversible conditions. So it can also be it doesn't exist in the body, and it can also be an excluding for the matching phenomena. Then we can have a second discrepancy. It's usually the fillings are present in the teeth and they're not shown in the records. And one should always basically, as a dentist, if he's a working or a practicing dentist, one should always record the fillings. Just to basically, if we basically are going to match these records with a dentition at our hand, one should have documented those fillings in his or her writings or in his or her clinical notes. If it's not mentioned, one cannot use it for the comparative studies. So these are all the discrepancies that we can come across at a particular stage whenever we are going through the process of personal identification through the dentition. So that is the end of this section. Thank you for watching sqadia.com.